to give you a little just to give you a little bit of background on the National Weather Service. So our mission is for to provide weather, water, and climate information for the protection of life and property and the enhancement of the national economy. So that's our main mission. And in Arizona, we're divided up. That map there on the right shows our division, our service areas by offices. So you have four National Weather Service offices that serve Arizona, starting off in the Northwest. Mojave County up there is actually served by Las Vegas, our office in Las Vegas. The areas in yellow there is Flagstaff, and us in Phoenix in that blue area, and then our office in Tucson down in the red. So that's so you can kind of get a feel for those, what service area for the National Weather Service you fall under. There's a unique area down in for Gila County and Pinal County where our office in Phoenix covers southern Gila County and Flagstaff covers the northern part of the county, and then Pinal County we cover the northwest basically third, and then Tucson covers the southeastern 2/3 or so. So a little bit of quirk there, but on to the next slide. So I'll kind of get from the very start, talking about the preparedness level. And a lot of the organizers in this heat workshop that we're conducting today are also part of our multi-agency collaboration effort for Arizona Heat Awareness Week, which we've defined now as May 6th through the 10th. And there's just a select few of organizations there on the left that we're collaborating with. Department of Health Services also filed to get a proclamation for Heat Awareness Week in Arizona with the governor's office. So hopefully we'll have that in time for that May 6th week campaign. And we're going to kind of do a similar campaign as we've done in previous years with the themes headlined with heat. So Monday we'll talk about hydration issues, and then talk about the weather and environment on Tuesday, overall awareness on Wednesday, and then actions to take on Thursday, and then kind of summarize things on Friday. But we ask you to kind of be that, everybody on this call, to hopefully be that force multiplier to help educate the public of the dangers of heat as we share things on social media. All our agencies are going to be sharing different things on social media. We hope you will retweet or share that information on Facebook, and we'll be advertising websites and things like that. They're kind of under construction right now. We'll be advertising that as we get a little bit closer. So so that's in the preparedness. On the next slide, as we talk about our seasonal outlooks now, so even out to 3 months, I mean, we've already got our seasonal outlooks for the upcoming summer, and this comes from our Climate Prediction Center on our national level, and you can see the maps there on the right, but they divide things up by 3-month increments, and you can get that information on that website at the top there. They divide seasons up by 3-month increments, and so, for instance, when we're talking about summer here, those maps on the right there, those are the current outlooks for the months of June, July, and August from our Climate Prediction Center. And it's an overall average temperature for the entire season. So there's going to be some ups and downs like there is in any season, but that's going to be the overall trend in the both the temperature outlook and the precipitation outlook on the bottom. Now, just be aware, these are probabilities. So kind of a trend in one direction or another. It's not a guarantee by any means. And so there's actually some interactive data on this website too, in that chart there in the middle, and you can put in your location. So for instance, I just typed in Phoenix, Arizona to get the exact location for the outlook information. Then it gives you a pie chart of the probabilities for above normal, below normal, and near normal conditions. And so while the map there on the right really highlights the Western US with the trends toward above normal temperatures and kind of up the Rocky Mountain front, below normal precipitation, but that does trend to kind of ease into Arizona as well. So once again, this outlook coming up is a little bit of a hedge toward below normal precipitation. and then a little bit stronger hint of above normal temperatures. And really the precipitation is going to be that driver. Like last year, we had such a dry monsoon. We didn't have those clouds and those thunderstorms to really cool things off. And so, that was what kept those temperatures continue to be elevated day after day, and not a whole lot of relief. So, again, we're trending a little bit drier again for this upcoming summer. Hopefully not as dry as last year, and then hopefully not as hot. But we'll have to gauge them as we gauge these conditions as we get closer. And I'll talk about that here as you go to the next slide. So beyond the 3-month outlooks for those are your seasonal outlooks. Now you get a little bit closer, and our Climate Prediction Center actually has outlooks for 6 to 10 days out, 8 to 14 days out, and even a 3 to 4 week outlook. The 6 to 10 day, 8 to 14 are updated on a daily basis. So the one thing to watch is the 3 to 4 week is only updated on Fridays. So that can tend to get a little stale, but if you jump on it on Fridays just to kind of get a feel for it, 3 to 4 weeks out, what it's going to be looking like, you can get the most updated information. But these are the current trends. As of yesterday, they don't have the new ones out yet today for the 8 to 14 day, but you can kind of see how they're displayed. So this is 8 to 14 days out. So for instance, this is the 22nd through the 28th. So you're getting toward the end of April now. And a good chunk of the CONUS is trending toward above normal temperatures beyond that 7-day period. We're kind of split here in Arizona. We got kind of a onshore pattern coming in the West Coast. So the West Coast is hinting toward near normal temperatures and actually above normal precipitation. And we're kind of caught in the middle there with a kind of a trend toward just a little bit of a trend toward above normal temperatures for that time frame. So, and this also has an interactive option too. There's a button there to click on interaction. You can type in your exact location again and give you a pie chart of those probabilities, those exact probabilities of above, below, or near normal conditions. And then that 3 to 4 week outlook too goes a little bit further. If you're looking for signs of when's that heat wave really going to hit us, or when's that heat wave going to finally end, the 3 to 4 week outlooks can be helpful with that, or when you think the monsoon might be starting to kick in and things like that. So again, just some resources to check out. If you go to the next slide, now we get even closer, and I'd encourage everybody to understand what their local National Weather Service is that services their area. If you type in weather.gov, that just goes to the national website, and you click on your local area. That should zoom right into your local National Weather Service office website. So, for instance, if you just click on right around Phoenix area, for instance, you can come to our website, and no matter which website you go to, on the top there's graphics that kind of highlight what concerns we have in the next 7 days. And so it's a good briefing tool to pull up our website on a daily basis to see what's the Weather Service trying to tell us for the next 7 days of concern. So it's a great briefing tool. I hope everybody kind of bookmarks those websites to take a look at on a daily basis. Again, so that's in the first 7 days. If you click on the next slide, what a driving force for our excessive heat watches and excessive heat warnings is heat risk. So everybody's got to kind of understand that. Back in 2008, I believe, we transitioned from the heat index, which you're probably familiar with, which was done years and years ago. But out west, where we didn't have a lot of humidity, we trended a little bit more toward heat risk to utilize for a driver behind our heat watches and warnings. And it's a color coded and number scale, and it's a graphical format. I've got Arizona here on the right, and you can see the different color codes based on the forecast conditions. And it puts it in a climatological context and how unusual the heat is for any time of the year, the duration of the heat. We're looking at both high temperatures and nighttime lows. Last year we had all those above normal 90-degree low temperatures. and then it links it to CDC mortality rates and things like that. So there's a lot of science involved in it. Once we get into these red and purple magenta colors, now you're talking about that's the most excessive heat that's going to impact most people out there. So when you see our watches and warnings come out, that's the driver. If you click on the button there, you can actually click on the map. You just forward one slide there. If you click on the map, then you can get an actual detailed 7-day forecast for any location. I chose here down by Tucson, for instance. So it's a good tool to brief you on the upcoming heat risk. On the next slide. So this is, again, our driving force between the watches and warnings, and we issue excessive heat watch when we're anticipating major or extreme heat risk coming up, mainly in the next 3 to 7 days, depending on our confidence level. So if we're above 50% confidence level, even out to a week in advance, we may issue excessive heat watch. And then when a heat is imminent or already occurring, that's when you'll see the excessive heat warning come out from us. That will again indicate imminent threat of major to extreme heat risk affecting the most of the population. Some areas, especially even in Arizona, you will see some heat advisories out there. It's kind of a level below the watch and warnings, just as an awareness. We don't issue those down in the desert areas because we'd have a heat advisory out all summer long. So it wasn't much of a benefit for that. Advance to the next slide. Be sure to follow us on social media. Again, not only the awareness weeks, but we'll keep everybody updated on the latest short and long-term trends via Facebook, Twitter. Again, go to facebook.com, twitter.com, and just do NWS Phoenix, Tucson, Flagstaff, whichever office you follow, and keep an eye on our messaging there and graphics and things like that. On to the next slide as I try to wrap up here. We also have email briefings that we send out. If you are a core partner where you have critical decision making that you may want additional heads up, that we do provide impact-based decision support briefings through these emails. There are different levels. In Phoenix, we do them on a daily basis. Some offices do them daily, some offices do them weekly, and some offices do them on event driven. So again, contact your local office if you're not getting these and would like to. It's a good heads up for any kind of weather coming up. Today, obviously, we're talking about heat. Next slide. And then pulling everything together, we do have a one-stop shopping National Weather Service heat page. It's linked on our local Phoenix page under the local programs menu up in the upper right-hand corner. But this kind of brings everything together in a 7-day forecast. You have links to the heat risk. You have probabilistic forecasts. You'll hear a lot more probabilistic information we talk about. What's the chance of us hitting 110 over the next 7 days and things like that, and all the outlook information I talked about and safety information, all kinds of different stats there. If you click the button once, Jennifer, and then right now we have this set for 4 locations. For Arizona, 3 locations, specific locations. We can probably add a few more in there if requested, but it's kind of a good overview of all the resources that I've already talked about. Then on the next slide, so there's our contact information. So I'd be your contact for our office here in Phoenix. And then again, define where you're located under what service area, and you can contact any of us and we can get you answer any questions you have or need any information you need to be added to our distribution list and things like that. Just give us a holler. So I think that's it for me. Is there any questions?
Sorry, I think we forgot to mention, but we're going to collect the questions in the Q&A section of this meeting, and then we will answer them offline and send an email out to everybody that registered and participated today. All right, next up we have Monica from ADHS. She's an epidemiologist with our Office of Environmental Epidemiology, and she's going to give us an overlook of last year's heat morbidity, mortality. Monica, if you're speaking, we can't hear you.
Oh, can you see my screen right now?
We can see your screen.
Thank you. Hi everyone, my name is Monica. I work as an epidemiologist in ASOP, and I'm at epidemiology at Arizona Department of Health Services. I'm going to talk about heat-related illnesses in Arizona, especially 2023.
Sorry, Monica, are people having a hard time understanding? Yeah. It might be helpful to sign out and sign back in. It's very choppy. Like,
Oh, 1 second. Can you hear me right now?
right now we can hear you.
Okay, 1 second. I'm really sorry about that.
No problem.
You can see my screen, right?
Yes.
Okay. So first I'll talk about the heat-related death data. So we usually analyze the data from death vital inventory registration, and based on the analysis, we observe 987 preliminary heat-related deaths in Arizona in 2023, and notably 77% are male.
Sorry. It's breaking up. It's really hard to hear.
1 second, I'm really sorry.
People in the chat are suggesting it could be my feedback. Maybe call in by phone if you can, and I can advance your slides and share the screen.
Can you hear me right now?
Yes, that sounds clear. Let's try this.
Okay. So 77% of them are male and 36% or 45 to 64 years of age group. And ethnicity wise, 57% among them are white and 24% were Hispanic. And 47% of the residents lived in Arizona for 20 years and more. And 52% of these deaths were associated with substance use such as drug and alcohol use. So in the next slide, you can observe the number of heat deaths from 2019 to 2023, and you can observe there was an increase in trend, especially if you compare to 2022, there was a significant increase of deaths from 1.5 times in 2023. And if you look at the distribution of deaths among the counties, you can observe most of the deaths are occurred in counties like Maricopa, Mojave, Pima, Pinal, Cochise, La Paz, Santa Cruz, and Yuma. And the other counties which have less than 6 cases, they have not been visualized. And if you look at the heat-related deaths association with drug use, you can observe there has been an increase in of association with drug use in 2023, especially with drugs. And you can observe from 2022 to 2023, there was a 5% increase of drug-related heat deaths. And even from 2019 to 2023, there has an increase in trend of the drug usage among heat-related deaths. And in the death records, we have this variable called injury fields, and we analyze the keywords in the injury fields to discuss whether heat-related deaths occurred outdoors or indoors. For the outdoors, we use keywords like desert, yard, highway, mountain, area, bridge, path, canyon, trail, etc. And for indoors, we took keywords such as indoor, air conditioner, air conditioning, and cooling system. And based on these keywords, when we analyzed it, we found that around 56% of the heat-related deaths occurred outdoors in 2023. And even from 2019 to 2023, you can observe that most of the deaths occurred outdoors than compared to indoors. We'll move on to the hospital discharge data. So most of the hospital discharge data are from all the Arizona licensed hospitals, but we exclude patients located in tribal land, Department of Defense, Indian Health Service, and VA hospitals. The full results and analysis of 2023 data, it is not available yet, but based on the preliminary data we had, when we analyzed it, we have seen these trends. Especially if you look at the emergency department visits and hospitalizations in Arizona from 2019 to 2023, you can observe there has been an increase in trend among the cases. And if you look in deep further, AD visits, there are around 4,301 cases recorded in 2023, and among them 68% were male, 45% were from 20 to 44 years of age, and 59% were white, non-Hispanic, and 26% were Hispanic. And if you look at the hospitalizations, there were 1,322 cases recorded, and 77% were male, 35% were 45 to 64 years, and 62% were white, non-Hispanic, and 21% were Hispanic. And substance use was listed in 20% of the ED visits and 58% of the hospitalizations. And you can also observe that there were 42% of ED visits and 92% of the hospitalizations listed comorbidities, primarily mental health disorder and circulatory diseases. The detailed reports of both heat-related illness, hospital emergency department, and inpatient admission report, and as well as the mortality report, they are available in our ADHS heat safety page, and you can access through that. The emergency department and hospitalization report, it describes data by demographic factors and others such as comorbidities like heart disease, respiratory disease, obesity, and mental health. And also you can observe substance use, place of injury, and preceding activity reports. And the mortality report describes data by demographics, residents, years lived in Arizona, substance use, and place of injury. Right now in the ADHS heat safety page, only from 2018 to 2022 is available. 2023 data has not been released, and probably it will be released by the end of May. If you're more into like visualizations and trends, the data, especially from 2005 to 2022, HRA ED visits and hospitalization data available in our EPHD Data Explorer. I can share the link with you in the chats. You can observe in this, the Data Explorer, the HRI ED visits and hospitalizations by month, age group, gender, year of accounts, rates, and age-adjusted rates at county and sub-county geographies. Or you can also access the link of the website through the QR code that I have in the slide. And next we have like the Arizona Department of Health Services, we developed a public-facing dashboard for syndromic surveillance, and this dashboard displays heat-related illness emergency department visit trends using the syndromic surveillance data. You can use it for the real-time information for heat-related surveillance or for any situational awareness among the partners, something like that. And if you look at the website, you can access the how many cases were being recorded during the summer months, and you can access the data by the months, age group, gender, race, and ethnicity. And if you want like a specific county, you can click on the county cases and you can see the bar graphs for the months, county, age group, gender, race, and ethnicity. And this data is only updated during the heat season from May 1st to October 1st each year, and the data is provisional and it will be updated every Sunday. And you can view this website using like PC or through the mobile phones, but there has been a 2-week lag time when we are uploading the data for the quality assurance, but we are trying to cut it down to 1 week. If you have any questions about the data or anything, I'll put my email ID in the chats. You can reach out to me. Thank you.
All right, thank you. Give me a second to share my screen again. Great job, Monica. Thank you so much for giving us that presentation. Next up, we have Eugene Levar. He is our Chief Heat Officer here at the Arizona Department of Health Services, and he's going to talk about the Arizona State Heat Plan and how ADHS fits into that.
Hi, good morning, everyone. Hopefully you can hear me on
Yes.
that end. Good. So happy to be here today, this morning, and to go over some of this information. If we could go to the next slide, please. We'll be going over the extreme heat preparedness plan today, and in going over that information, we'll go over the agenda, which will be in the next slide. So we're going to go over a little bit about the context and the contents of the plan, go over general emergency response approaches, some implementation information, collaborative opportunity, and just highlight a little bit about what's new in 2024. So we'll go to the next slide. We'll zero in on that. First topic of context and contents. So looking here, we can see drivers behind the plan and efforts include what we saw in July of 2023, being the hottest summer month in Arizona for 14 of 15 counties, along with the preliminary data that we just heard about around heat-related illness and deaths. And I think as we're looking forward and also seeing those projections by 2030 that Arizona is projected to experience up to 117 days over 100 degrees Fahrenheit, plus the staggering number of heat-related illness ED visits that we just saw, and the expected numbers of deaths in 2023 to surpass what we saw in 2022, just heightened awareness and also the need for moving forward with some next steps. Next slide, please. So how was the plan developed and what was the process? So in August of 2023, Governor Hobbs issued an executive order 2023-16, which required the director of the governor's Office of Resiliency to coordinate and lead an interagency effort to develop an extreme heat preparedness plan by March 1st, 2024, among other actions and priorities. And we see here that there were many collaborative efforts and events through ASU, ADHS, and the Governor's Office of Resiliency that led to the March 1st report. Next slide, please. So what are the plan elements that we see here? The report looks at some key questions and topics from heat vulnerability, who and what is impacted and how, heat and impacts to human health, urban and rural heat impacts, and this leads to the primary plan elements of cross-agency preparedness for heat season 2024 and long-term policy and operational recommendations moving past 2024 and into the future. So what are the big highlights to hit for summer 2024? Well, there are, a couple of primary objectives and topics that we're zeroing in on, as you can see here, concerning shelter, health, energy, disaster response, and then the prioritized mitigation emergency response in the executive budget going on for 2024. And then we see what are some of the long-term recommendation topics. They revolve around safe and affordable housing, adapting and updating emergency response plans, cooling center network improvements and support, and data sets, knowledge, and workforce development. Now, in follow-up to the governor's extreme heat preparedness plan and the heat health summit that was held in October of 2023, Arizona Department of Health Services developed the complementary recommendations and findings to go along with Governor Hobbs' extreme heat preparedness plan. It identified 12 recommendations that we presented as individual briefs aimed at reaching 4 overarching goals. And those goals include to drive heat relief activities, reduce heat-related illnesses and deaths, prepare for extreme heat, and foster innovative solutions. Along with that plan, they came up with a set of performance measures to hit by June 30th, 2025. We know that these solutions that are going to be coming forward aren't something that we can just do immediately. They will take time to kind of go through the process and be able to get input and find next steps. And you can see here that we came up with some recommendations of what we're going to want to see within these measures. These performance measures were established to monitor progress and give solid timelines to those goals. And I'd also like to note that ASU recently released their 2024 recommendations report to the Office of the Governor on extreme heat preparedness in Arizona as a great supplemental resource that we'll be looking at and measuring some of those insights also. Next slide. So now we're going to hit a little bit on the general emergency response approach for 2024 and beyond to just share some awareness. The recommendations and findings establish heat response activity tiers, thresholds, and activities throughout the year. This is found on page 17 of the recommendation and finding document. These include multiple tiers and possible actions identified in the slide that you can see here. And the tiers include pre and post heat season, cautionary period, heat emergency, multiple emergencies occurring simultaneously, and then recovery. We'll move on to the next slide, please. And then during heat season, each local and county jurisdiction may decide how to intake and triage resource requests. But if local resources are unable to meet needs, an established resource request process can be leveraged. Utilizing such a process will give a formalized approach, can ensure information and justification of requests are gathered for those requests that are being sent forward, and it can paint a picture of burden if a declaration or outreach to federal partners is needed. You can see here just a visual display of the general resource request process from local, state, and federal steps. And it's something that we've used in emergency responses in the past, and it can be something that just can be leveraged and give us a formalized approach. Next slide, please. So now we'll just go over a little bit about the implementation of the plan. Next slide. So looking at implementation and current efforts, we're hoping that stakeholders can meet regularly. We're hoping to research funding. Within identifying gaps and implementation of needs, we hope to meet regularly to prioritize ideas and policies, ongoing identification of projects and ideas that we can leverage throughout the state, really looking for some of those solutions that may be outside of the box. And we wanted to make sure that we always have a health equity lens as we move forward to recognize and template great work that we see within our urban areas, but also provide attention to rural areas and vulnerable individuals that may not be benefiting from some of those current heat response efforts. Next slide. And looking at the implementation of the Extreme Heat Preparedness Plan, it requires sustained cross-agency and cross-sector collaboration. And part of the identified objectives within the plan, it identifies my new position, which is the Chief Heat Officer, to help coordinate heat-specific efforts between agencies on shelter, energy, health, and disaster response. And just to explain a little bit about that process that we're going to be utilizing, we'll take a look at the graphic here and we'll start from the bottom and move up. So if you look at the bottom, you have task force teams, and this group will consist of members that are actively involved in those work groups and can be assigned specific tasks to complete the activities. And we'll be dealing with and identifying regional needs, and they'll be worked through those task force teams. Up above that, you see all partner networks of work groups that the Arizona Heat Preparedness Plan will be established as a component of the Interagency Resiliency Forum on the top. And this group will consist of all the members within the work groups and any other members or organizations that would like to stay up to date on heat relief activities throughout the state. And this network will ensure a statewide interest and will be incorporated into all activities to build statewide capacity and ensure robust input from tribal, local governments, and cross-sector stakeholders. The Office of Resiliency will continue to convene the Interagency Resiliency Forum, and this forum is made up of agency leaders, private sector, and community-based partners with a focus on preparing for extreme heat events and other resiliency efforts. And information from the multiple sector work groups and task force that we see below will be shared with the Interagency Resiliency Forum for guidance and to ensure successful implementation of ideas and activities and efforts across the state. We'll go to the next slide, please. So now we're just going to hit a little bit on collaboration opportunities that we're having at the state level. So we'll move to the next slide. So state level work covers 5 core topics. We have data to see enhanced resilience, sustainability, policy, and innovation. We're building a strong infrastructure, communicating to promote heat resilience, and heat relief coordination. I think one important note here is that we do not want to take over or disband any current efforts or work groups that are in existence, but we'd like individuals or points of contact to join and share insight into these great efforts and best practices within our state work groups. Some of the things that can be shared during the time that these work groups meet are ongoing local efforts, develop resources that are already out there, and then share inputs and thoughts of information so that that can be fed up to the Interagency Resiliency Forum, who will help decide on state priorities and decisions as mentioned previously. Would like to highlight if anybody would like to participate within this, please reach out to AZHeat at azdhs.gov. Thanks, Jake. We'll go to the next slide. So what's new in 2024? So we just wanted to highlight a couple of the things that are new for this summer and this year. So we have the Chief Heat Officer position, also enhanced coordination among statewide efforts. The executive budget identified funding and hazard mitigation and emergency response. The construction of at least 6 retrofitted shipping containers that can be quickly set up for cooling relief efforts. State employees can opt to staff cooling centers and receive regular duty pay. Identify thresholds that enhance heat response activities. Centralize state and county dashboards to display heat-related illness and death data. We had the passing of House Bill 2146. It's effective immediately for mobile home park owners that can't prohibit ACs or other cooling accessories on mobile homes, which is great to see. And then looking at state agencies, we have some efforts going on there that were identified and moving forward. We had the Governor's Office of Resiliency that identified $13 million in grant funding to make necessary grid improvements in rural areas. Next slide, please. We have the Arizona Department of Housing that funded 4 new awards to expand existing emergency shelter responses to severe weather. And they also expanded heat relief funding to include heat respite, bottled water, water fountains, food, sunscreen, clothing, navigational support to shelters and mental health care and food banks. And we have the Arizona Department of Corrections and Rehabilitation and Reentry that are implementing excessive heat safety and relief strategies and starting a capital movement plan to convert all housing units from evaporative cooling to energy efficient HVAC systems during this year. And then to round things out, we have the Department of Emergency and Military Affairs that updated their state emergency response and recovery plan, and also evaluating how to better measure the impacts of extreme heat events utilizing national best practices, framework of community lifelines. So some movement in 2024, and then I'd be remiss if I didn't go ahead and mention, if you're looking for information regarding the plans or other items that are going on within our state, want to keep up with state work groups and different activities that are happening, we'd love for you to visit azdhs.gov/extremeheatprep to be able to get easy links to those documents and efforts as we move forward through heat season. And with that, I'll just say thank you so much for the time to present today. Hopefully that provided a little bit of insight into the governor's heat plan and some of the supplementary documents that go along with it and some of the efforts that are moving forward within 2024 and beyond. Thank you so much.
Awesome. Thank you so much, Eugene. Next up, we have our panel with our distinguished speakers. So I'm excited to hear what all you guys are going to talk about. Moderating today, we have Ladd Keith from the University of Arizona, and I will hand the mic to you.
Great. Thanks so much, Jennifer. So thanks again for joining us this morning. My name is Ladd Keith, where I'm an assistant professor of planning at the University of Arizona, and I research heat planning, policy, and governance. I think it's notable that this is our 8th annual heat planning workshop, and how much has really been accomplished by partners and collaborators, grassroots efforts across the state compared to our first heat workshop. And I know that many of the folks that are joining us with the workshop are those that have worked towards those successes. So we certainly want to celebrate all of the work that's being done across the state. So with that said, I'm excited to moderate this panel, which features Arizona's local and tribal heat preparedness efforts, where we'll be able to get a little bit of a deeper dive into some of the planning and actions taking across the state and hear about how those pair with the new state level efforts that are going on. Our panel today includes Dr. Rebecca Sunenschein with Maricopa County of Public Health, Dr. Teresa Cullen with Pima County Department of Public Health, Lynn Harlow-Smith with Yuma County Public Health Services District, Dariel Yazi with the Navajo Nation Division of Public Health Service, Dr. Dave Handula with the City of Phoenix and ASU, and Fatima Luna with the City of Tucson. So kind of a large panel. Each panelist will have about 5 minutes to share their efforts to address extreme heat on their local level. And then as time allows, we'll have a few questions and answers at the end. And as was mentioned earlier, questions that aren't answered due to time constraints will be compiled and answered as possible after the workshop. And just a reminder to the panelists, when you want to advance the next slide, just let Jennifer know the next slide. So Rebecca Sumenshine, if you would like to join us, we can hear about some of Maricopa County's efforts.
Good morning, everyone. First, I just want to thank you and thank ADHS and everyone for the opportunity to present today. This is something that is such a critical public health issue, and it's incredible to see all these organizations coming together and coordinating these efforts. Next slide, please. All right, and next slide, please. So obviously, folks know that you saw the data statewide. In Maricopa County, we have a pretty robust heat-related death surveillance system, and the heat-related deaths increased 52% from 2022 to 2023. And I saw in the chat someone asked, well, could this be attributed to population? The population increase from 2022 to 2023 was nowhere near 52%. So we know that our rates far exceeded in 2023. And this is actually an 800% increase over the last decade. And Maricopa County really is seeing the majority of these heat-related deaths. Next slide, please. So there was a lot of talk last year, a lot of concerns about sort of the lack of centralized coordination, and a number of stakeholders. I know they came to the state, they came to the governor, and they also came to Maricopa County leadership and really asked for there to be some structured, centralized coordination. So we had already hired a climate and health program manager, Dr. Jessica Bell. Many of you know her. But we were fortunate enough, and we joke that we found money under the couch cushions, to hire a heat relief coordinator. His name is Francisco Garcia, and he was hired in the last couple of months to really help us centralize our planning and communications for heat relief. We also were very fortunate, and I just can't thank the county enough. Between public health, CDC grants, and the county, we identified nearly $4 million to do the following, to achieve the following goals. So goal number 1 is related to transportation and heat relief call center support. So I put the evidence underneath so you'd know that everything that we've done is based on evidence either from our 2023 cooling center evaluation, or from past cooling center evaluations, or other data that we have. And we learned that 54% of Maricopa County visitors walk to cooling centers, and that one of the bigger barriers that was reported was a lack of transportation. And a lot of folks talked about either not knowing that cooling centers exist, or they simply could not find cooling center locations. So Maricopa County Public Health took an existing promotora program, and those are bilingual community health workers. And we have 30 FTEs who are staffing. We put out a request for proposal, and we were very fortunate to have awarded it to Solari 211 call center. So those 30 bilingual FTEs will be staffing the 211 call center from May through September to answer any heat relief calls. So yes, anyone who needs to find a cooling center location can call, but it's not just finding the nearest cooling center. We're going to make sure that that cooling center meets their needs, with whether it be storage or pets, or even being connected to services. We're also going to make sure they have all of the information on heat relief resources like air conditioning repair and replacement. They're also going to be evaluated for heat-related illness in case there's an emergency happening at the time. And lastly, we're going to make sure that these people who call, if they need transportation to get to a cooling or respite center, that they get a ride. And I know there were some issues last year, but Solari is being funded much more robustly this year, and we hope to alleviate those issues. Next slide, please. So goal number 2 is increasing visibility with signage for heat relief network locations. And you can see the data right there. I won't repeat it, but more than half of visitors did recommend notifying people about cooling centers with signs from the street. So grateful for City of Phoenix's partnership. They have developed signs with the Maricopa County Heat Relief Network logo. No city information, no government information. We really want this logo to be Maricopa County's symbol of heat relief. And they're providing them to all cooling and respite centers and hydration stations throughout the county. And we've worked together to find funding to make sure that they were translated into Spanish and 7 additional languages. And they're going throughout the county. Next slide, please. So additionally, we're working closely with ASU, has a wonderful cooling center optimization system where I won't go into this map too much, but those purple and blue blobs represent cooling or respite centers in a 1-mile radius around them. We've mapped them with the locations of 2022 and 2023 outdoor homeless heat deaths, as well as areas of homelessness outreach. And that has helped us make sure that where we put our funding and our cooling center resources is where they're most needed. Next slide, please. So with that, we've expanded cooling center hours throughout Maricopa County through 2 methods. One is an IGA with the municipalities, and the other is an RFP that should be coming out this week, finally, for community organizations that operate 2 or more cooling centers. In our cooling center survey, they identified that they would like cooling centers to be open at least until 7 p.m. So our goal here is to make sure that there are cooling and respite centers in every part of Maricopa County that are open until at least 7 p.m. And we have additional resources to make sure that we have more cooling centers and respite centers open during those hottest months of July and August. We're also working with them to report monthly financial and evaluation data. And all of these efforts that I've spoken about, again, are funded through CDC grants and with ARPA funding. And I wanted to highlight, and I've talked to Eugene about this as well, that all of the funding that we've identified is not sustainable. So we're really hoping and relying on all of this coordination to help us identify sustainable funding. And next slide, please. I want to talk about our final goal, which I hope this will help us get more sustainable funding, is getting better and more data to improve heat relief in 2025. So we have a special evaluation team that are working with all of the funded municipalities and community-based organizations to get very granular data, really focusing on the number of people served per hour on weekdays after 5 and weekends. How often do they reach capacity so we can put our resources where they're most needed? How often do they turn people away? And then enhanced evaluation at the City of Phoenix overnight centers, because this is the first time that there will be overnight centers, and we're so excited to partner with City of Phoenix in that evaluation. We're also doing a voluntary electronic survey in July for non-funded cooling centers, and that's just requesting that they help us with daily counts of people served, water supplied, folks served after 5 p.m. We're going to make an easy 3-question survey. And then lastly, we're going to have a week in August focused on shelters open nights and weekends. And I do want to highlight that for those who don't receive direct funding, we are providing heat relief supplies because we want to make sure that everyone gets access to some of this funding. Last slide. We also do have a public health, heat and health strategic plan, which includes all the other county agencies that are involved, our partners in the medical examiner, emergency response. And I won't go into this plan. I just want you to know that we have them. And next slide, please. I just wanted to thank so many people who have worked really hard on all of these plans. They're listed here. And I'm just grateful for all the support from the state and from the county and from the folks listed on this slide. Thanks for the opportunity.
Great, thank you so much, Rebecca. Next up, we have Dr. Teresa Cullen with, again, Pima County Department of Public Health.
Hi, good morning. Thanks everybody for inviting us. Rebecca, Eugene, everyone else who presented. Thank you so much for the work you're doing. I'm going to start with acknowledgements right now from Pima County. We've been lucky in that our administrators stood up a climate executive action plan. Their first focus was on greenhouse gas. It's now focused on heat. We did that earlier a few months ago, and I'm really grateful for that. We also used some of our funding to stand up the first Office of Climate and Environmental Justice that we had, and Julie Robinson, Kat Davis, Shanika Serial, many other people at the health department are responsible and contributed greatly to what I'm going to present to you. So next slide. I want to remind people just about Pima County. We are the border, the largest contiguous border. Cochise, Santa Cruz, and Yuma are also down here with us. You can see we're home to two tribal nations, Tohono and Pasquayaki, who we work very closely with. And our social vulnerability index for our county is 0.88. So we serve rural, semi-rural, urban, semi-urban population that tends to be quite vulnerable. And I'm not going to go over our statistics. I think that they were pointed out earlier with other people's information. Suffice it to say, we do work closely with our Office of Medical Examiner to ensure that we are able to appropriately and accurately track our heat deaths, as well as look at our heat hospitalizations through the rest of the network. Next slide. So what I'm going to present to you is really our goals right now. And I don't have a crowded slide because it makes me crazy. So after I present some of these, I'm just going to read a little, and we can make sure our heat response plan, which is a county-wide plan, however, with the Pima County Health Department in the lead, can be shared with others. So first, collaborative planning. As you saw from our slide, we have two large reservations in our midst, and we have a very myriad number of different jurisdictions. We work closely with the other incorporated jurisdictions as well as the unincorporated jurisdictions, engaging community stakeholders. And as part of that, we have formed a joint heat action team. Fatima is on this call, the city of Tucson, who we work very closely with. And our hope is that we, at the end, very soon as we go into June, we'll have a combined heat county plan, we believe, for both of us, as well as the other jurisdictions. That will be the most effective way for us to approach this. We also are in the process of developing heat safety policies and procedures for Pima County workforce. We are aware that, the governor has done some work there. That will obviously, anything we develop would go through our board of supervisors. Our board is looking at the possibility of an extreme heat preparedness proclamation or resolution, very comparable to what the state has done, with the belief that that just will emphasize how important this is. Our outreach includes a multilingual Beat the Heat comms campaign. You may have heard of that. It's been around for a long time. We do expect that we will be increasing the amount of information and communication we do. Our hope is not only to work with the city of Tucson, but as you heard Eugene and Rebecca say, that the need is for collaboration between all of us, that we have one message that we are giving, that we have hopefully one number where anyone can call wherever they are in the state to make it easier for them, but also to ensure that we have a broad understanding throughout the state, especially for the rural counties that may not have the resources available to them that Maricopa and Pima have, that we are consistent with our approach. We also, as part of this, prepare for accelerated sheltering and medical services. This is really working closely with our Office of Emergency Management, as well as OEM from the other jurisdictions throughout the county, to identify cooling centers and ensure that they have auxiliary power. So the next slide talks about reducing the impact of heat. And this is where you see identify and prioritize vulnerable populations in urban as well as rural areas. We use ArcGIS regularly, like Pima, like Maricopa and the other counties do. Very similar to the slide that Rebecca shared with you. Her slide is pretty, that purple, really nice. But our hope is to be able to make sure that we can adequately address the needs that are identified, so that there is a distance between that people will be acceptable, to ensure that people have access, once again, to cooling centers, and disseminate, for us at least, the criteria and guidelines for the cooling center operations. We did this the past 2 years. I would share with you that I think we need to step up our game, and we need to do more of this. And we are in the process of ensuring that we will be able to do that. What Rebecca shared about Maricopa, this need to extend between the normal hours, 8 to 5, 7:30 to 5:30, was something we noted too. So we are in the process of evaluating if and how we would be able to ensure that cooling centers are accessible and reflect what the needs are that we're hearing from the local population. We also have partnered with PAC, Pima Animal Control Center, to ensure that dogs and animals will have a place to go with their owners. We do clinics right now, mobile clinics into the community with animal owners, as well as providing care for the animals. And we know how critical this is to ensure that people will seek services. And finally, activate community emergency response teams with the 5 tiers that the state uses. Next slide. Finally, I think this is really the most important thing. It's not the most immediate thing, because what we want to do is ensure we save lives and we have a safety net. However, as we move through the next few years, as we heard from NOAA, this increased expectation that heat will worsen, it does require us to ensure that we figure out what does community resiliency to heat-related challenges look like. Some of that is ensuring that there's comprehensive training and education programs. Some of it is ensuring that an individual may be able to assess their own risk. So if people are on certain medications, for instance, that are prescribed, they may be more at risk. We have that information on our website. However, we know that many people aren't accessing our website for different reasons. And so the goal of developing a way for an individual to quickly assess what their own heat risk and at what point they should take action has been discussed. And we're in the process of trying to figure out how to do that, with the belief that that will really help save lives. Community-centered models to address heat. Resiliency hubs is talked about a lot. One of the CBOs down here, and Fatima may talk about that, has gotten some funding to develop resiliency hubs. We believe they're a critical part of what we do. And then these long-term strategies, which I think are really important. Housing is health, ensuring that people have access to appropriate housing with adequate and affordable cooling. Rebecca talked about this. There has been discussion, we know, with many of the electric providers in the state to ensure that at least the cooling is available. We have done a policy brief on mobile homes and how critical it is for there to have appropriate cooling there. We've worked to develop with our development services goals for at least within the urban area, urban planning. What does that look like for shade and infrastructure, as we know that can decrease the heat exposure by 10 to 20 degrees. I did talk about our first emphasis with climate action on greenhouse gas emissions. That's a huge priority within the county, that while it may seem arm distance from the heat, is actually a major contributor. And so we need to be attentive to that. And finally, the need to identify policy changes. All of this requires data. Rebecca did a great job talking about Maricopa's data. Last year, we actually borrowed their survey. This year, we're probably going to borrow their survey again. Our goal is to help ensure that while we may collect data separately, that it can aggregate in a way that can help not only Pima and Maricopa, but can help the state and the rest of the citizens. And that is my last slide. Thank you very much.
Great. Thank you so much, Dr. Collin. Next up, we have Lynn Harlow-Smith, and they're with Yuma County Public Health Services District. So, Lynn.
Hi, good morning, everyone. Can you hear me okay?
Yep, we can hear you.
So Lynn actually had a family emergency, so she is not able to attend. So she asked me to take over. So my name is Ellie Farfan. I'm also with the Yuma County Health Services District. I'm the planning and training specialist for the Emergency Preparedness and Response Division. So I'm not sure if Lynn had a slide available.
She did not have slides.
Okay, so then I'll just do some quick talking points in regards to what Yuma County is doing. At the moment, we don't have a specific grant related to heat mitigation, but one thing that we are working on is our yearly cooling centers and water centers. We have a beautiful community here in Yuma County where we provide our resources to help our residents, and a lot of our cooling centers right now are being ran by our nonprofit organizations or some sort of like church, or we have the Red Cross, we have the Mission, the food bank. So we do a yearly map that I'm actually finalizing right now that we'll distribute to different organizations and share on our website, so that people know where they can find cooling and or water centers. With that comes education as well. So we try to do forms of education, whether it's classes that we're having at our health district, or go to like the Red Cross, go to the Salvation Army, where we know that people will be there to be providing that education of how to prepare yourself for the heat. Like one of the slides said, they're people who have lived here for many, many years. So even though we've lived here for 10, 15, 20 years, we're still not used to the heat. We still experience those adverse effects. So we talk about ways to, what times to avoid if you are on certain medication. Talk to your doctor if there is a different medication, a different dose, especially those who use public transportation to get to and from doctor appointments. So education is very important. It's one of our aspects that we focus on the most. And we also have something called Check on Your Neighbor. That's not ran through us, but through our Wilton, which is on the outskirts of Yuma County. It is more of a rural area, and there isn't a lot of infrastructure out there, but there is a lot of residents that are over the age of 50, 55, and tend to live alone or tend to live on more separate areas, so they don't have as much neighbors. So one thing that the Welton EMS services out there, what they do is they have a list of individuals who they know primarily live alone or who have experienced heat-related issues in the past, and they'll check on them, or they'll give each other a call every other day just to make sure that they're still okay. And if they haven't heard a check-in, then the EMS will go out to their property to make sure that they are just okay. And then they do their own education through their EMS service of, checking on people that live in your area. Sometimes I've known that they're a couple 100 feet separated, so maybe don't go in the middle of the day and check on them, but go early in the morning or late at night once it's cooled down just a little bit. So those are just 3 of the things that we focused all of our time in the past. And we're hoping that moving forward this year, we continue to grow those cooling and water centers. Thank you, everyone.
Great, thank you so much. And next up, we have Daryl Yazi with the Navajo Nation Division of Public Health Service. Daryl?
Good morning, everyone. If you would, first and foremost, let me give my thanks to all of you for the invite to have me join the panel, and to all of our members throughout the state with FEP, ADHS. Thank you for having me. As protocol would guide me to do, to introduce myself, I always have to do a tribal introduction. That's how we do it, and is meant for us to maintain that approach. Yat Eshe Ya Daryl Yazi and Shia Ado Done and Shlini Ebit Anin Shlon Ebit Ani Bashichin Kin the Chini Eda Shnala Aro the Koje the Shache Tebi in Skydo I see Nashai Arshiaho. What I shared was my 4 clans and the area where I'm from. I am from Monument Valley. I grew up in an area called Cane Valley, most notably known for its uranium mining efforts. I've been a part of Navajo's Department of Health managing the FEP program for just about 1.5 years now. And a lot of what I've come to learn and understand is that we are lacking in many areas, including heat mitigation, dealing with extreme heat measures. Let me, if you would, allow me to share with you, let me paint the landscape of what we have at Navajo Nation. Navajo Nation, as a sovereign nation, we cover 27,000 square miles, or roughly 17,280,000 acres. We're roughly the size of the state of West Virginia. We have a population close to 400,000. We have 18,000 miles of roads, and only 3,000 of those are paved. We have 13 grocery stores over that landmass. We have 12 healthcare facilities, 5 of those being actual hospitals. We have 200 police officers to cover that entire area. We have climate predictions that are based on radar Doppler systems that do not exist on Navajo. We're the size of the state of West Virginia, but we don't have any Doppler radar systems on Navajo. We have 2 mountain ranges in the middle of Navajo Nation. And when you think about climate, those mountain ranges impact how weather patterns are forecasted and how they flow. %40 of our population lack electricity. 85% lack natural gas or sometimes propane. 40% lack clean running water. Addressing these mitigation plans, addressing these extreme heat measures, we work with a limited emergency management team who had up until recently only consisted of 2 people, a office staff and a liaison. We have 110 chapters and we cover 3 states. 89 of our chapters are in Arizona, 3 are in Utah, and 18 in New Mexico. We have 81 senior centers under the Department of Aging and Long-Term Care Services. We also have 5 wellness centers under our Navajo Special Diabetes Program. We have on the ground helping us 70 CHR staff to cover all 110 chapters. And we have a very, very rich cultural history that teaches on perseverance in accepting what we have, not complaining about climate, being grateful of conditions as they are intended with purpose. Taboo discussions of illness and death, but we also have to highlight our core teachings of preparedness. We do not currently have any grant funding for heat mitigation efforts. So that kind of paints the landscape. Coming into FEP now in the 1.5 years that I've been here, we've been prioritizing educating community members at the chapter level, community members with our educational system, the private sector, business sectors, as well as in prioritizing and highlighting our tribal leadership to understand the NIMS ICS structure, so that we're all communicating in one language when we're talking mitigation efforts, response efforts, and understanding what we need to do on our part. And a big part of that in recent months has been updating Navajo Nation's hazard mitigation plan, which involves pretty much our entire governmental body to have input on what we have on a grand landscape of who Navajo Nation is. And then from there, we're plugging in a lot of numbers to show what we're doing, including heat mitigation. So from that landscape that I painted, we're a large reservation with limited resources, beginning with the most basic stuff, running water and electricity. It's hard to plan where I might be able to establish a cooling station if I don't have electricity. So what we've been doing is coordinating with our 110 chapters and using the chapter facilities if and when they have either air conditioning or even swamp coolers to establish our cooling stations at. We've worked with our emergency management team to purchase water and deliver to our 110 chapters water as needed. That's been ongoing and even continued through winter months, because we went and transitioned from extreme heat to extreme colds. So the efforts not being just a seasonal summer event, we've kind of taken that same approach to an all year round event because of how extreme it gets with our cold temperatures here. Snow, rain, mud, access roads. I pointed out that out of the roadways that we have, that 15,000 of those roads are all dirt roads, and it looks completely different when we're wanting to deploy resources to the 110 chapters or community members who are requesting assistance, and the first thing we need to do is upgrade the roads just to get access to the homes. So there's a lot to unpack here and a lot to really identify through educating our team here first at Department of Health. And I rely heavily on my teams here with our Daltecs in the senior centers. We use those as cooling stations. We use our special diabetes wellness centers as cooling stations. We utilize all of our CHR staff to be boots on the ground to identify where our high-risk clients are at, who might not even be able to get out because they don't have a landline to call from, or they might not have a cell phone to call from. If they have a cell phone, they might not have service where they live. So with that being said, they become my boots on the ground and are able to retrieve and report back to us who our clients are that need assistance and what kind of assistance they need. So it's become a coordinated effort, but through, I think, all of these years dealing with heat mitigation, there's a lot of knowledge that exists, but bringing everything together and coordinating it and developing policies and plans to move us forward. And now with the identification of new plans that are headed up by the state, that will help us. That will help us to secure what we're doing. Grant funding will help us to make that work as well. But we have a lot to unpack. We have a lot to really develop, where if you've ever listened to my partners from the counties that we exist in, we work with San Juan County in Utah. We work with Cibola County, McKinley County, and Socorro County, and Bernalillo County in New Mexico. And then we have Coconino, Navajo, and Apache. And so when we're looking at this, we have a lot of people that we can coordinate with. When I've talked to my partners, a big part of what had been missing in the past was perhaps there wasn't that coordinated effort coming from Navajo. So part of what I'm trying to build and instill with the group that we have here is that we do have partners that we can look to help us and assist us with how we move forward. So that's been our plan. It's really in development right now, but it's probably in a better place than it had been in previous years. But I really have to take my hat off to Navajo Nation's Department of Health, who had operated without a FET manager, operated with a very limited emergency management team from Navajo Nation, and relied heavily on our Department of Health teams from our EPI team, Daltex, Special Diabetes, CHR, Health Education, and as well as our Department of Behavioral Health and Mental Health. So it's been a collaborative effort, but we want to take that collaborative effort and expand it out. Goals that we currently have is really to continue and prioritize the NIMS ICS training so that we're speaking one language when we're talking about response efforts with the community, with leadership, and educate and really develop policies on approaches that have been taken in years past. So that's where we are. Thank you again for the invite. Definitely appreciate it and appreciate the discussion. Appreciate all of your efforts. Thank you. Over.
Great. Thank you so much, Daryl. Let's turn it over now to Dr. Dave Handula with the City of Phoenix.
Yeah, thanks, Led. I hope you can hear me okay. Thanks, and yeah, good morning, everyone. Thanks for including me on the panel. I'll certainly be reiterating some themes we heard, and would like to reiterate an important theme from the last speaker, the idea of being sure as many of us as possible are trained on NIMS and the ICS framework. I think we've heard in conversation with other levels of government all the way up to FEMA that we're not yet sufficiently mature on having this resource request conversation in the heat space. And I think part of that is, for those of us in the heat world who do not come from an emergency preparedness background, is to learn that language. So I'd really like to plug that point. I'll just very briefly share a couple of highlights of the City of Phoenix's heat response plan. This is the third year we've had a heat response plan. A clean version of the document is coming soon, but for those who are interested to engage, the plan as posted in our city council packet about a month ago is linked in the chat now. You can also read about the city's budget situation in that time. Next slide, please. Our plan is divided into 9 different strategy areas. Sorry to our host, if you wouldn't mind clicking them in, there will be 9 of them. As they come in, I'll just highlight that there are special measures that our first responders take to keep themselves and the public safe during the heat. 2 more clicks, please. Certainly a focus on cool space and drinking water, as we've heard about, and you can see the other areas shown there. About 40 actions total are in our heat response plan, in which we think that the city has some type of coordination or leadership role, but many of these actions are executed collaboratively with the partners we heard from today, with local community-based organizations and more. As Dr. Sonnenschein mentioned, absolutely, please go forward to the next slide. Thank you. As Dr. Cullen mentioned as well, really trying to lean on the data. I think 6 bullet points will come in here for our driver. We're certainly reliant on the county, and we look at state data as well, and then try to look at the Phoenix specific version of those numbers. In some cases, our data skew away from what we see for the county or state as a whole. We also look at our 911 data related to heat, which you can see a heat map of on the slide, on the graphic there. And we are trying to compare where our city facilities are to where the highest concentration of calls are, to try to solve some of the challenges that have identified in our heat relief efforts in the past. One more bullet point I think will come in here. What we've been, I think we've all known this is the case, but it really jumped out at the reporting last year of our heat-related deaths among people experiencing homelessness, which is more than half of the total, and very, very disproportionately high when we think about rates. 90% of our cases experiencing homelessness have substance use indication of some kind. I feel like we have not given sufficient attention to this important intersection in the past, and thanks to our public health advisor, Nicole Witt here at the city, we are taking some more meaningful steps forward on that front this year. So move ahead to the next slide. Just wanted to highlight a couple of the ways we're improving our plan and our efforts this year. A few bullets will fly in. Our 4 will come in there. Thank you so much to our navigator. Our Office of Homeless Solutions, we see as a really vital part of our heat response effort. They've staffed up tremendously over the past few years. And as such, we're really helping try to guide their efforts as related to heat, ensuring that their teams that are out in the field have all the resources they need to not just keep themselves safe, but also keep people safe in the community with whom they're engaging. And we continue to find different ways to engage what we find to be a really enthusiastic and supportive volunteer corps here in Phoenix. Whether it's having teams providing heat safety education at our most dangerous trailheads on the summer months, to helping prepare supplies that our homeless solutions staff will have. We're so appreciative of what volunteers are doing. We know their efforts are helping us all save more lives. On the next slide, some may have seen the news that Phoenix passed a worker safety measure a couple weeks ago. That complements improvements we've been making to our own internal heat response plans for the roughly 15,000 City of Phoenix employees. We now have an ordinance in place that adds worker safety protections for the roughly 10,000 contracted, subcontracted, licensed, and leased employees with whom the city engages. Those measures are beginning to roll out. They largely parallel what's in the state emphasis program that was adopted by ADHS last year. But what this change ultimately to the city code does, it allows the city, or gives the city the option to have contractual enforcement or engage in contract-related mechanisms, potentially including termination if our business partners are not following our heat safety expectations. And then lastly, as Dr. Sunshine alluded to, and others, we are trying to solve, if we go to the next slide, please, we are trying to solve, or at least be part of the solution to this extended hours and overnight shortcoming that I think we've had statewide in the past. In the city of Phoenix, we see about 1/3 of our heat-related calls, 911 calls, occur outside of the hours that our own facilities have been open. So this year, we're adding overnight capacity at 2 locations, one which will operate 24/7, the other will operate roughly 6 or 7 p.m. to 6 a.m. Professional navigators there who can help ultimately, we hope, solve the upstream challenges that brought people to those locations in the first place. We know many of them will be in some circumstance related to homelessness, but we also want them to be able to address landlord-tenant issues, broken air conditioners, emergency utility assistance, whatever those needs might be. And as Dr. Sunshine mentioned, we know it will be critical to have good evaluation data of these efforts this summer to understand why people are coming and how effective we've been in trying to solve some of their immediate and upstream challenges. And then one final slide, in addition to these 2 overnight locations, we're extending cooling center hours at 3 others. You can see the stars on the map, and hopefully you're convinced they line up with where our 911 hotspots are. That's the density map in the background. Adding hours till 10 p.m. at these 3 city libraries, and adding capacity on Sundays as well, having the facilities open for the cooling center purpose on Sundays when they've been closed in the past. And we have checked with the National Weather Service. Sundays are just as hot as every other day of the week. So it's really been, unfortunate isn't the right word, but I think it has been just a shortcoming of our efforts not to have that availability on Sundays. So we're trying to do more, taking a big step forward. I do want to acknowledge funding and thinking and collaboration, input and partnership from the state, from the county, from our own heat team at the city, especially Michelle and Julia who are on, as well as our newly formed heat executive leadership team. And as we transition out on the final slide, to reiterate the theme from the previous speaker, we are really trying to lean in to the emergency management infrastructure. We have formalized an incident management team for this extended hour and overnight mission. Our emergency manager, fire chief, public health advisor, homeless solutions director, and the heat office are all involved in a leadership and coordination capacity to try to make this new investment as successful as possible. Thank you, Lad. Thanks, ADHS, for organizing.
Great, thanks so much, Dave. And now we'll turn to our final panelist, Fatima Luna with the City of Tucson.
Thank you, Lad, for the introduction. Can you all hear me okay? Perfect, and thank you for having me here. Again, my name is Fatima Luna, pronouns she and her, and I'm joining from the ancestral lands of the Tohono O'odham and Pascuayaqui peoples in Tucson, Arizona. And so today I'm going to briefly share some of the work that the city of Tucson is doing to build heat resilience. Next slide. And so, previous slide. So we all know that extreme heat is experienced differently across communities, with low-income communities and communities of color being among the most vulnerable groups. So at the City of Tucson, we are using several tools to identify vulnerable populations, including the city's created Equity Priority Index, Tree Equity Score Map, Social Vulnerability Index, 911 data, among other tools. And so these tools really allow us to direct and prioritize investments. Next slide, please. So the City of Tucson is working both internally and externally to address the impacts of extreme heat across the entire city. And so city departments already implement extensive heat protections for employees and residents with various programs and policies. And so, for example, the Office of Risk and Management and Emergency Management is our primary office that works on heat awareness. They train city employees on heat risk and prevention. The Community Safety, Health, and Wellness Program and the Public Safety Communications team are at the front lines for the most vulnerable people during heat emergencies. They distribute water and they connect residents to other resources. The Housing and Community Development Department offers several services, including mobile showers for the unsheltered community through the Housing First program. They also offer home repairs and weatherization for eligible low-income families. Using our climate resilient funding, this department also supports groups in the community or CVOs in the installation of solar panels in low-income communities. And so we are also working with them to establish the first city-operated solar empowerment program to further support low-income families with solar panels and potentially to reduce their energy bills. Tucson Water also provides low-income assistance programs to ensure families continue to have access to safe drinking water, especially during heat waves. And the Climate Action Team and the Office of Resilience, we work on building heat resilience into our city operations and with regional partners. Next slide. So the City of Tucson has cooling infrastructure throughout the city, including parks, pools, splash pads, drinking fountains, and water bottle filling stations in city parks. And also we have 6 cooling centers, 1 in each ward. We recently received a FEMA grant that will allow us to work with community members in co-developing the framework for an ideal community-based resilient hub. This grant we're also are going to partner with the Nature Conservancy to pilot a community resilience leadership academy, similar to what they did in Phoenix with the Heat Leadership Academy. Our hope is that we would ultimately build resilience at the neighborhood level. And this grant, part of what Dr. Collin mentioned is that a CVO and Tucson Amistades recently received an EPA grant for resilient hub planning. And so they're looking at mobile resilient hubs, and we are coordinating these efforts to make sure that we engage with community members and that we don't replicate efforts. Next slide. And so given that the transportation sector is responsible for a large percentage of heat trapping emissions, it can also play an important role in addressing urban heat. So the City of Tucson has a complete streets policy to support multiple modes of transportation. Proposition 411 has become a path to financially support this policy by allocating 20% of the $740 million investment over 10 years to safety investments, and this includes like bicycle network improvements, sidewalks, traffic calming features. Additionally, Mayor and Council made transit fares free since the pandemic, and it continues to be free, so helping riders move through the city and get to cooling centers. Additionally, the city is on its way to have a fully decarbonized bus fleet with compressed natural gas and electric buses, thanks to significant federal investments. My office also partnered with the Department of Transportation and Mobility to create and test a bus stop design to better or help cool riders as they wait for the bus. So we're expecting to have the design before the summer, and our goal is really to create a network of shaded bus stops or cool corridors across the city to increase that mobility. As we learned from like the previous presenters, people do walk to to cooling centers, and so having free shaded bus stop systems, it's really important. Through the Storm to Shade and 2 million trees, the city is also increasing tree canopy and green infrastructure in heat vulnerable communities. Additionally, the city and a coalition of partners were awarded a resilient and efficient code implementation grant, or the RECI grant, from the Department of Energy. And this is to develop the Southwest climate adapted building codes that will promote high energy efficiency buildings or new construction, while also addressing affordability. And finally, in 2022, the city of Tucson allowed for accessory dwelling units, or casitas, to be built, and they are required to include reflective cool roofs to reduce temperatures. Next slide. So there is a lot of heat-related work that the city of Tucson is already doing, and we are currently putting all of these together, reviewing best practices, looking at the existing plans at the state level and other cities, engaging with the community as well to develop the city's heat preparedness response and mitigation plan, or I would just call it like the heat action plan for sure. So 2 months ago, the city of Tucson partnered with Pima County Health Department and the University of Arizona to host the first ever Southern Arizona Heat Planning Summit. And the objective was to unite local and regional stakeholders to contribute to the city's climate action plan. And so the ultimate goal is to enhance heat response, coordination, and mitigation strategies, identify gaps, and also uncover potential opportunities to increase heat resilience in the community. So the summit was well attended with over 110 representatives from across sectors, including health professionals and emergency managers, urban planners, utility operators, first responders, researchers, community leaders. And so these are the areas that we focus on the plan, and our goal on the workshop. And so our goal is to have a draft and present a draft to Mayor and Council before the summer. So in essence, the heat action plan will not only continue, improve, but also expand on many of the actions that the city is already implementing. But it would also have new actions to increase our regional resilience against heat. So our plan is to work with the Pima County Health Department to have a consolidated heat action plan for our region that is aligned with our collective goals for a coordinated response for extreme heat. And so one of our primary objectives within the city of Tucson is to present Mayor and Council with the plan, and also have a heat protection ordinance for city employees be among the first initiatives that are approved under the plan. So as we look forward to finalize and implement the heat action plan, I want to emphasize the significance of our collective efforts, the internal and external synergies between city departments, the counties, local jurisdictions, but also stakeholders, and moving it all the way to the state and other jurisdictions. It's key. And so together we can craft like a framework that can proactively address the different layers of complexity that are involved with heat mitigation and management. And I'm happy to answer any questions. Well, at the end.
Great, thanks so much, Fatima. All right, Jennifer, do we want to turn the slideshow off so we can see all of the panelists? Okay, we can at least see some panelists, so that's a start. So let's go into the questions and answers, and we'll just go for a few minutes before we wrap things up for the workshop. But Daryl, let's start with you. So what support, coordination, or collaboration would better help the Navajo Nation prepare and address extreme heat?
I think it's already happening. I've got a great rapport with Coconino County. Blake over at Coconino County is truly an asset to me, to know that I can give him a call, I can send him an email. He's got answers for me. If he doesn't have an answer, he knows where to point me to a good resource. I've got Kirsten Vandeventer, who's been fabulous, and I've just been so grateful that she's been willing to help me. My counterparts at Navajo County and Apache County, with Heather and I'm forgetting her name, with Kim O'Farrell. I've got a terrific cast around me, and I think from what I've gathered from people who've been in the position for a while is they really just need someone that's willing to reach out to them and ask those questions and ask for that help. And that's what we've been doing. We've been bridging those gaps and trying to get away from the mindset that everybody's going to operate as in their own individual silos. I think those of us in the health field have all heard that at one point or another. You tend to have those isolated entities that operate on their own, but with what we do, we truly do have to build those bridges and coordinate. Over.
Great, thanks so much. Ellie, let's ask you the same question for Yuma County. What support, coordination, or collaboration would really help better prepare Yuma County to address extreme heat?
So I think a lot of it, I know we hear this term a lot, and I know we talk about it a lot, but I think funding is very important, especially what I view on our end for our cooling and water sites, because we do have specific grants and funding that don't allow us to provide them even just water to go help and assist. I think that is very important, because that's one thing that I noticed as I'm doing my call to these organizations, and at least 10 out of the 20 that I call are like, are you able to assist us in getting water? Because it comes out of their own budget. And so I think that is number one. But the beautiful part of it is that we're hoping to kind of do like a water fundraiser for our community, where community members can go ahead and donate that, and then we would distribute it. So that's one, I think, funding. Two, I think personnel as well, because a lot of those organizations are volunteer based. So that if we wanted to extend our cooling and water centers to be longer hours, a lot of them do close at 5, 6, and wanting to expand a little bit later, do they have the personnel to go ahead and staff those? And then two, do we have personnel staff to work those, even if it's not overnight, but till about 10 p.m. and those safety risks that will come out of that. So I think the two that I see the most is going to be funding and personnel. I think for the most part, we are very good in collaboration. It's just a matter of collaboration only goes so far if we don't have enough resources to go ahead and respond to our mitigation efforts that we would like to see happen. And that also comes in with other infrastructure things that we have. We do have a transportation system. It's not as expanded as we have in the Phoenix area or the Maricopa area. So some of our bus stops aren't as localized to the cooling center, or the stops are a far distance in between them, the times of it. So I think infrastructure is also very important, that our community does need to see as well, to be able to prepare not only during the heat times, but all year round as well. Thank you.
Okay, good. Thank you so much. Dr. Cullen, let's turn over to you. What changes do we expect to see with the heightened emphasis on heat preparedness in Pima County? So you've mentioned some of the plans and the joint heat action team that's been put together. What other changes can we expect to see this summer?
Well, I'll do the summer, and then let me do long-term, and then I'll do the summer, because I think long-term is where we really need to put some of our focus. So we're not just being reactive or being proactive. Fatima talked a lot about this, what the city of Tucson has done in terms of looking at ways that we can mitigate heat in 3 or 4 years, planting trees right now doesn't give enough shade, but in 3 to 5 years, it may change that canopy. And I think that striking picture that Fatima showed between two of our neighborhoods, you may be aware one of those neighborhoods is quite wealthy, one of them is not, is also an indication of what I hope we do see more immediate. This recognition of who is at risk, and Dr. Handula talked about this, the risk of dying from heat when you are unhoused, if you have any underlying substance use disorder, puts you at tremendous risk. You're more at risk in our case, depending upon where you live in the city, because of your exposure, for instance, from a mobile home park that was built in the 1950s and doesn't have adequate cooling. So I hope as we move into our plan, we have had this huge learning cycle from, I hate to bring up that word COVID, but from COVID, related to how to do micro precision, how to target neighborhoods that we know are most at risk, either from 911 calls, first responder calls, or because that's where we've seen the death, or because we know geographically and from infrastructure they are most at risk. So we expect to use that learning again as we go into the summer to ensure that we can adequately identify who's most at risk. Hopefully within Tucson and the city and the county, we will see also an expansion of access to access to cooling/respite centers. We do not have the funding available that Dr. Sonnenschein talked about for Maricopa County. So instead of looking under the cushions, we're looking out throughout the environment to figure out if there's a way that we can leverage, once again, the volunteers I think that Ellie just talked about and that other people have mentioned. We have long history of working closely with our Office of Emergency Management, activating an EOC. I'm really hoping I don't have to do that for heat, but that we have enough prevention in place that we will be able to mitigate what we know is going to be a hot season. Thanks.
Great, thanks so much. Dr. Sonnenschein, let's turn it over to you. So what aspects of your planning efforts do you anticipate to be the most challenging to implement this summer, and what can be done to help support those efforts?
So it's a great question. I think that I think the piece that we are most excited about is having a centralized systemic solution for getting consistent information and education out about heat relief through the 2-on-1 network. So I think we need to make sure that all of those pieces are fitting together, that when someone calls and if they ask for transportation, that it's really working smoothly and they really do get that transportation and that they're connected into all the different systems. Speaking for challenges, I think we were very fortunate to have funding. In general, our biggest challenge is not necessarily in 2024, like Dr. Cullen mentioned, but it's going to be able to sustain the infrastructure that's created. MAG started a voluntary heat relief network. We're in a position now, we're able to centralize, coordinate through our heat relief coordinator. We're working with all of our partners to make sure that they're in, but without that sustainable funding moving forward, we're not going to be able to keep any of it going. So I would say overall, our biggest challenge is sustaining what we've created. And then I don't want to speak on behalf of community-based organizations, but I think the two biggest challenges that they're really facing at cooling centers are number one, staffing. As Fatima mentioned, staffing is just really challenging, especially after 5 o'clock and on weekends. Sunday, as Dr. Handula mentioned, is just as hot, and a lot of our organizations are run by faith-based organizations, and they really struggle to or are unable to support cooling center and heat relief on Sundays. So those are the things that we're really focused on. But again, long term is we would really like the federal government to identify a specific grant for heat relief and recognize that the states that face heat are in as big or bigger of difficult circumstances as those in colder weather states. Thank you.
Thank you so much. Fatima, I'll have you to answer the next question. So you mentioned the city is working on its heat action plan, and there may be a consolidated opportunity with Pima County. How do you see all of these planning efforts working together from city to county to state level?
Thank you. Yeah, so I am very excited to be working with Dr. Collin, her team. We started meeting bi-weekly with her team to really start thinking about, at least locally, how can we coordinate efforts for heat preparedness and response and have a coordinated, consistent communication strategy, having our plans come together and align with each other's collective goals. And so my hope is that we can start at the local level and continue to bring that higher up to the state level, hopefully federal level. And so I love to stay engaged in all the conversations that are taking place at the state level. All those working groups that Dr. LeVar mentioned, I think are important, but we also need a Southern Arizona conversation that can then be informed, vertically, so like up and down. I think that is going to be crucial as we coordinate efforts to not only avoid duplication of efforts and funding, but stack the funding opportunities, the resources, so that our impact can, be expanded even beyond our local networks. So I'm hoping to stay connected. I'm hoping to continue these conversations, and I'm hoping that the people in this panel has like ongoing conversations of the things, the challenges, lessons learned, opportunities for collective like grant funding opportunities. And also share the things that we're learning as well. So that's what I'm hoping that we can, be successful in this very regional way.
Great, thank you so much. And Dave, I'll have you answer the final question before we turn it over back to our State Chief Heat Officer, Dr. LeVar. So how do you see all these planning efforts working together? And I know Fatima mentioned the federal aspects. Of course, we have our National Weather Service partners with us today, but we were also recently visited by NOAA that did a site visit and kind of were learning about some of the ways that our cities and counties up to the state are preparing for heat. So how do you see all of this fitting together?
Thanks, Lad, for the question. Before I answer that question, I'll reiterate from the City of Phoenix's standpoint the same concern about the sustainability of the funding, and I love the ideas we've heard thus far about where to ask. I hope we all also recognize that the headlines that come out of our heat challenges are not good for business in Arizona, which to me suggests another pool of potential investors in these efforts. If you're looking to build a building here, bring your business here, operate your business here, I think you have a stake in the success of this whole mission as well, and we can lean on that. And would love to hear and develop ideas with anyone here about how to do that. To answer your question, Lad, how are these plans all going to work together? One, I don't think you meant to do this, but one, we can lean on our academic partners who study how plans work together to tell us if they are or are not. Lad is one of those. So I'd encourage folks to talk to Lad, and Lad shows up at every meeting to see how this is all working. So Lad, good on you. I think the evaluation component that Dr. Sonnenschein mentioned is going to be critical as we can all look at collectively the data that are coming in newly this summer, as well as evaluation data from the past. We can learn how to work together. And I think it's going to take all of us continuing to participate and engage. We had more than 210 people here at some point. If you heard something that seemed contradictory between two plans, we might have missed it. So please do speak up. I think we are at a moment of some growing pains, as Dr. LeVar occurred to, where we now have a rush of new meetings, a rush of new work groups, new engagement. They are certainly growing pains. There's pain sometimes on the calendar, but also a lot of growth coming with that as well. And I think we need to work through that. We will work through it toward the beautiful structure that Fatima was describing, vertically and horizontally. I think we'll get there. So I think we just need to buckle up and hold on for a summer or two as we have this new cascade of engagement. Thanks, Lad.
Great, thanks so much, Dave. And yeah, to your point, just looking again at the attendance list, just want to recognize all of those folks who have done great work, over the years related to heat. So kind of see grassroots folks, faith-based organizations represented, private sector, of course, cities, counties, up to the state. So a lot of folks here that have been participating in those efforts. And I think to reiterate your point, if you are new to this and want to get involved, there's certainly more than enough that we need folks to help out with, right? So kind of an opportunity for that as well. So Dr. LeVar, I'll have you come back on and kind of give the final word, any reflections that you've heard listening to the panel, and wrapping up our 8th annual Extreme Heat Workshop.
Thank you, Led. I appreciate just a few moments to kind of wrap things up here at the end. Hearing about such great strategy planning and preparedness activities happening across our state by our panelists is so encouraging and humbling that Arizona as a whole is up to the challenge of heat season moving forward. I truly believe we can collaborate and support each other to ensure our communities are ready. This can be done, as you heard mentioned, with coordinated media and messaging campaigns, streamlining resource needs and request processes, working to determine policy gaps and solutions, and advocating with our federal partners of state needs and requests as we move forward. I know I need to have a listening ear to hear all community needs from across the state and leverage our in-state expertise and talented Arizonas as much as possible, as we heard Dave mention here at the end. And I would just like to say, let's learn from the past and move forward in a collaborative manner as we enter heat season in 2024. Thanks, Lev.
Great, thank you so much, Dr. LeVar. So Jennifer, I'll turn it back over to you if you want to bring up the final slides.
Yep.
And any final closing statements or remarks you would like to make, Jennifer?
All right. Well, I just want to say thank you to everyone for your time today. Thank you for coming together and hearing what our state is doing about heat. We know that our partners have been very much involved in this for almost 2 decades. So thank you to everyone that's involved. And we had some questions come through earlier about how to get involved. So I just wanted to put some emails, addresses up here. We obviously can't put all the links through Zoom on how to get more information, but if you want to visit azdhs.gov/heat or email any of these folks, we will get you in touch with whatever you're interested in and how to move forward and get involved. So with that, I just want to say thank you and have a great day.
Thank you.